Dealing with a yeast infection can be an uncomfortable experience, but don't worry, you're not alone. This common condition affects about 3 out of 4 people with a vagina at some point in their lives, and oftentimes more than once. I'm Dr. Jennifer McCall, and I'm an OB-GYN at the Ottawa Hospital. Today, I'll explain exactly what a vaginal yeast infection is, its symptoms, treatment options, and when to see a doctor. Vaginal yeast infection, also known as vaginal candidiasis, is a fungal infection. While yeast infections can also occur in other places in the body, like under the breasts, in the groin folds, or in the mouth, today we will only be discussing vaginal yeast infections, which are not typically related to the other locations. Common triggers include hormonal changes during menstruation and pregnancy, diabetes, using antibiotics, and HIV. Although it is not sexually transmitted, the risk of developing a vaginal yeast infection may increase with sexual activity. The most common symptoms of a vaginal yeast infection include intense itching around the vulva and vaginal area, irregular vaginal discharge, which could be odorless, white and clumpy, typically resembling cottage cheese, burning sensations, especially during intercourse or while urinating, and redness and swelling of the vulva. These symptoms can also be caused by other conditions, which is why it is important to be assessed by a healthcare professional. To diagnose a yeast infection, a healthcare provider may perform a speculum examination or collect a vaginal swab. Several treatment options are available for managing vaginal yeast infections. There are over-the-counter treatments, non-prescription remedies, including vaginal creams or suppositories, often provided in a package of 3 applications. These can be purchased over-the-counter without a prescription. All brands and generic medications of vaginal antifungals are equal, so you can choose whichever one you like. For prescription treatments, in some cases, a healthcare provider may recommend a longer course of treatment. This could involve additional over-the-counter packages or prescription medications based on the consultation. Some of these medications are oral tablets. Regarding preventative measures, individuals with recurring yeast infections may need preventative treatments. Discussing these options with a healthcare provider could be beneficial for you. Avoid using non-pharmacologic remedies that are unproven, such as putting other items or remedies in the vagina that are supposed to change the vaginal pH. These are unproven, and their safety is questionable. You should see a doctor if you are experiencing yeast infection symptoms for the first time. You are not sure whether you have a yeast infection and need a proper diagnosis. You still have symptoms after treating with over-the-counter antifungal cream or suppositories. You develop additional symptoms such as fever, chills, or severe abdominal pain, or if you experience recurring yeast infections, indicating the need for a more thorough evaluation and a long-term treatment plan. It is essential to consult a healthcare provider to ensure you receive the correct diagnosis and treatment, especially if you have recurring issues or if over-the-counter treatments are not effective. Your doctor can provide guidance tailored to your specific needs and help prevent future infections. Remember, a vaginal yeast infection is non-contagious and treatable. If you experience any of the symptoms mentioned, see a specialist or visit your pharmacy for the most effective treatment. If you would like to learn more about vaginal yeast infections or have any concerns about your vaginal health, reach out to your healthcare provider. Thank you for watching.